Hello, BDS2. This is a video to give you a bit of a recap on dental fear and anxiety. We're going to cover some of the information that we've already spoke about in class, and this is just a little bit of a refresh so that you are not just visiting the material once. There should be nothing that's ridiculously new to you here. Most of it is stuff that you've covered already. It's one or two little bits that we're going to add in that will hopefully increase your knowledge of dental anxiety and where it comes from. We're going to look at the psychological side particularly, but the social as well of human behavior, and we're going to look at how these things impact upon a patient's experience within healthcare. We're going to look at what dental anxiety is, and we're going to look at the patient's psychological state in general and the kind of things that you might need to be aware of as a dentist when you're assessing and working with people who have fear and anxiety of dentists, but also of other situations as well. So hopefully by the end of this, you'll be able to describe the characteristics and the etiology of anxious, fearful, and phobic patients. And you're going to be able to describe how dental fear and anxiety can be assessed. Okay, so to begin with, we're going to look at what dental fear is. Now, fear is a normal emotional reaction. Fear is one of the basic emotional responses, sometimes called anxiety, sometimes called stress, sometimes called being afraid. They're all words to describe a very similar state and a very similar response. Like I say, it's very normal, it's very natural, and we all feel fear in different situations. Sometimes it might be fear of other people's judgment, sometimes it might be fear of sickness and pain. There's various things that we as human beings are afraid of or can be afraid of. Now, dental fear is, as you would imagine, fear of the dentists. A visit to the dentist involves various forms of discomfort. It involves the unusual situation of somebody poking around in your mouth. It might involve pressure in ways you're not used to. It might involve pain. It might involve being very vulnerable. All of these things are things that will naturally invoke fear in people. There can be lots of different things that people are afraid of within the dental environment. It may be the drills, it may be the sensations of air on their teeth. It may be having to open their mouth wide. It might be the whole experience. Any which way that you think about it, there's lots of different things for people to be afraid of within the dentists. Now, fear exists on a spectrum. When we talk about dental fear, we would see it as being normal, in air quotes, in the sense of a reaction that people would have that isn't necessarily out with the realms of experiences that most people have. It's something that they can maybe cope with. It's something that they're used to feeling in other situations as well, but maybe they can deal with it. We move up the spectrum and we think about dental anxiety. Dental anxiety is maybe a little bit more intense than just basic fear. A sort of apprehensive feeling that something dreadful is going to happen, that you're going to lose control. The more control people feel over a situation, the less anxious they feel. The more anxious people feel, the more anxious people feel is often related to feeling less control. If people are starting to feel a little bit out of control, like the situation is getting a bit too much for them, their fear can start to go up and start to move into dental anxiety. This is where it can start to affect their behavior. It can start to affect maybe their dental attendance. Dental phobia would be at one extreme end of the fear spectrum, where people have a severe manifestation of dental anxiety. It is a situation where their fear becomes so great that they maybe can't even function in ways that they would have before. It comes to the point where they find it difficult to interact. It comes to the point where they find it very difficult to go to the dentist. It maybe comes to the point where they even find it difficult to act in ways which would seem normal. They might scream, they might yell, they might feel very much out of control. The persistence is often a thing as well with dental phobia. People can feel anxious in one dental situation, maybe if the pain is extreme or unusual, but maybe not in other situations, just for a checkup. Dental phobia is really persistent over time. For a diagnosis of dental phobia, using the actual diagnostic criteria that's available within the DSM-5, there must be either complete avoidance of dental treatment or endurance of treatment only with dread or within sort of specialist treatment services. This is people who would need, say, general anesthetic for a procedure that most individuals would be able to go through without a general anesthetic, say a tooth extraction or something similar. What we find is that quite a reasonable number of people really don't like going to the dentist. Dental phobia and dental anxiety is relatively high. When you look at the sort of prevalence of it, you're talking, 13 to 19%. It's higher in females and amongst those who are older in general. It's also higher amongst deprived neighborhoods, and it's also higher in children as well. What you find is that these are factors that make some people more likely to have dental fear. So it's useful to know these because it's useful to look out for them. Now, this doesn't mean that people who are not in those characteristics, not in those demographics, don't feel dental anxiety, but it's useful to know what the associated demographic factors are. People who have dental anxiety are less likely to visit a dentist within the previous 12 months. This is obviously associated with problems, dental issues and dental problems will be more likely if you are not regularly visiting the dentist and getting your teeth checked. And as a result, they have all the various problems that people can have with their oral health. So it really is quite a major problem for a reasonable proportion of the population. However, that's not the only side of it. Some dentists also find treating patients with dental anxiety and dental fear and also dental phobia a real challenge as well. So dental anxiety can come from patients, but dentists themselves can have anxiety over treating such patients. They can find themselves in a reasonable amount of distress just with the idea of treating somebody who is going to be anxious. A study that's done quite a while ago now, but it's still relevant, looks at what is it that worries dentists when they're thinking about patients who have anxiety. Their major concern is the dentist-patient relationship. They're worried that the relationship between the two won't be as fruitful, as successful, as simple and straightforward, perhaps, as it would be with other patients. And they find this quite distressing. They find this quite difficult to deal with. For patients, we end up with this vicious cycle of dental fear and anxiety, where we have, say, dental fear or anxiety, which means that there's avoidance of going to the dentists, avoidance of dental situations. Therefore, as a result of that, they have a deterioration in dental status. Therefore, they have feelings of shame, feelings of inferiority, feelings of worry that if they go to the dentists, they will not only have to face pain and also discomfort, but they will also have to face shame and disapproval. That makes them even more fearful. And the fear is now not just about a physical sensation, but it's about the social interaction with the dentist being problematic. Again, relating back to the previous slide where the dentists were having a similar fear. This then results in more avoidance, and the cycle continues. So we talked about fear and anxiety and stress being similar terms and similar ideas. We're going to look at this definition of stress to see what stress actually is. Now, this is quite a wordy definition, and we've chosen it on purpose because of that. It says that stress is a negative emotional experience accompanied by predictable biochemical, physiological, cognitive, and behavioral changes that are directed either towards altering the stressful event or accommodating to its effects. Now, that is quite a wordy definition. Okay. So what I want you to do is I want you to think about stress from its biological perspective and how it works. Now, what I want you to do, imagine that you are a zebra doing its thing, doing whatever they do, eating the grass, I have no idea what zebras eat actually. I presume it's grass. And then all of a sudden, you're faced by the type of threat that has faced creatures like this over evolutionary history. And that is that you are facing a predator like a lion. A lion jumps out, and all of a sudden, you're in a very different situation from we were before. Now, what happens then is that your fight or flight response kicks in. It's a very old evolutionary system, and it involves the biological changes that were mentioned in the previous slide. And the reasons for these biological changes are to help you to either run away or to fight. You get things like pupil dilation, that's to let more light into your eyes. Your heart starts to beat more, that's to get blood around your body quicker and oxygen to the big muscle groups in your body so you can use them. You get rises in blood pressure as a result of this. You get various other changes. You get shallow, fast breathing, hyperventilation potentially, sweating in order to dissipate the extra heat that your body's creating. You get all these types of changes. Now, this is a really, really good system if you're a zebra being chased by a lion. It's a very good system if you're a creature that's facing a physical threat. It's evolved over many, many, many centuries, many, many billions of years, so that you can deal with physical threat as it comes to you. The problem for us as human beings is that threat lasts an awful lot longer than it does for a zebra. Zebra stress lasts about 3 minutes in the situation because it's either caught and it's eaten or it's escaped. It's a very, very good system for dealing with short-term physical threat. Problem for us as human beings, so we have the same system for dealing with threat. We have evolved for the same reasons. The problem with us for human beings is that we switch it on for what you might call psychosocial threat. Psychosocial threat. So whenever you are lying in bed at night, worrying about your dentist appointment the next day, what your body gives you is it gives you a hit of adrenaline and switches on your fight or flight response to get you to get ready to fight or run away. It's not a great system for dealing with going to the dentist, but this is what we use. This is what's called the 5-factor model. Comes from cognitive behavioral therapy. For me, this is the best model to use. Excuse me, I had a problem there with the recording. For me, this is the best model to use when we're thinking about patients and we're thinking about the ways in which they get stressed and distressed whenever we're working with them. The situation that somebody's in, like I said, with the zebra being chased, the situation itself can be stressful. Now, you could argue that the situation of going to the dentist is potentially in itself implicitly stressful, particularly if there's going to be pain, discomfort, or a sense of vulnerability. Lying back in a chair with your mouth open and somebody invading your personal space is a very vulnerable position to be in. So you could argue that there is reasons to say that the situation, the dental situation itself, is inherently threatening and stressful. Now, hopefully, as a dentist, one of the things that you could do is to try to minimize this as much as possible. It's why we use medications and various other interventions to relieve pain. The situation itself of having pain in your mouth or pain anywhere else for that matter is stressful. Therefore, it's, you could argue, reasonable to want to avoid that. However, you can get two different people who are in the same situation, and one is experiencing stress and one isn't. One of the places where there can be a difference with these two different people is in their thoughts. Now, thoughts themselves can be stressful. Like I said earlier on, whenever you are lying in bed, imagining your scary dentist appointment for the next day, nothing's happening in the situation. All that's happening is that you are generating imaginative scenarios in your head, and they're enough to stress you out. They're enough to cause you distress. They're enough to switch on your fight or flight response. Even we're the only creature, as far as we know, that can really cause ourselves a lot of distress purely by the way that we think. This is a problem for dentists whenever we're thinking about dental care and people who have fear of going to the dentist. Now, there are some areas where we know that people's thinking can be flawed and people's thinking can be causing them stress when it comes to the dentist. One of them is pure knowledge of modern analgesia. Patients may well have the belief that going to the dentist has to be painful, or it's just part of the whole process. Maybe they haven't been for many years. Maybe they've watched films or TV programs where the going to the dentist involves pain, and therefore they might not be aware of the fact that going to the dentist doesn't actually have to involve pain, just because they purely don't have the knowledge. Therefore, if we can provide patients with good knowledge and information about modern analgesia, sometimes that can be enough to change the way they think, and that changes the way that they feel about going to the dentist. Expectations of pain and discomfort as well. Patients may expect to feel pain. Now, the more that you expect to feel pain, the more likely you are to prepare for it, and by becoming stressed and tense. And the more stress and tense that you are, that can actually make you feel pain even worse. Therefore, changing the expectations can impact upon people's stress levels, and that can affect their pain perception as well. There's also other influences on their thinking as well. Family and peers is a big influence for people. If somebody has an anxious parent, If a child has an anxious parent and the parent is anxious about going to the dentist, a child will learn from that going to the dentist is something to be afraid of. It's something to be scared of. It doesn't even have to be something that a patient has seen. It can be comments or attitudes that have been communicated to them by other people that are negative about going to the dentist. This can change their underlying thinking patterns, and this can in turn make them more dentally anxious. As I've also mentioned before, media representations as well. It doesn't even have to be media representations that are realistic of going to the dentist. It can be cartoon representations. It can be dramatized representations. It can be scenarios where dentistry is used as some kind of motif to cause discomfort. It doesn't really matter. A representation of dentistry as being and dentists as being something to be feared can be enough to change people's thoughts, even their unconscious thoughts, their unconscious thinking patterns that they haven't really even noticed, that make them think that the dentist is something to be afraid of. History of trauma is also important when it comes to dental anxiety. We don't often think about this whenever we are thinking about patients with dental anxiety, but it's important, and it's becoming, the research is showing that it's becoming more and more important, or the research itself is showing more and more of this. Now, obviously, if somebody has had a traumatic experience in the dentist before, we can see how somebody in that situation might feel distressed coming to another dentist or another dental situation. Their previous experience has taught them that this is indeed something to be afraid of. However, what we find also is that people with various traumatic experiences that are nothing to do with dental care can also find that those experiences make them more likely to be afraid of going to the dentist. If patients, for example, have been physically abused, physical abuse involves various issues, such as potentially the invasion of personal space, the feeling of vulnerability, maybe being touched by other people in ways which are either unusual or are just being touched by other people. Now, going into the dentist, somebody who's had traumatic experiences that involve these types of elements may find that there's a heightened level of stress when the dentist comes closer to them than their normal personal space would allow, or when the dentist touches their face without asking for permission. These types of patients can find that situation to be very, very distressing. They can find a heightened level of anxiety. They can find a heightened level of fear. Results from this, and are less likely to come back to the dentist again. Now, whenever somebody is anxious, they are more likely to become phobic and or traumatized by coming to the dentist. We have to be careful whenever we're working with patients who are high in negative emotion. Particularly with these patients, we have to be careful that we act in a way that is appropriate so that they aren't left with either a dental phobia or with actual trauma from coming to the dentist. This will be a very unfortunate outcome if they do, and it will affect their ongoing health for the rest of their life potentially. So it's something that we want to avoid. So who is it that is most likely to become dental phobic or to potentially become traumatized as a result of going to the dentist, it'd be useful to know. There's a few characteristics. If somebody is generally high in their experience of negative emotion, then they're more likely to experience dental anxiety. Now, what we call this in psychology is we call it trait neuroticism. This comes from the 5-factor personality model, which is different from the CBT 5-factor model. It's very annoying. They're called very similar names. 5-factor personality model, one of the measures is neuroticism. Neuroticism is purely the likelihood to experience negative emotions. Some people are more likely than others to experience negative emotion across time, regardless of circumstance in their life. People who are high negative emotion are those who are most likely to be anxious within a dental setting or anxious in general, and are also potentially those who are most likely to have a negative experience of the dentists. So that's on the emotional side. When it comes to the cognitive side, the thinking side, pessimism and negative expectation. Again, somebody who assumes that they know that the outcome is going to be bad, assumes that they know that the process is going to be painful and or it's not going to make any difference to their lives. Those people are more likely to have problems when it comes to being anxious within the dental setting. We also have a trait called somatization, which I can never say properly, which is the manifestation of psychological distress by the presentation of physical symptoms. Now, we're not entirely sure how this works as a process. If people are in psychological distress, they may present with physical ailments, physical problems. Now, we do know that areas of the limbic system of the brain are associated with negative emotion and also motivational states such as pain perception. Now, it may be that there is a very close neurological relationship between things like negative emotion and pain. That much is clear. It may be that if somebody presents as having pain, it may be that there's a psychological distress element that's underpinning or that's causing their experiences of pain or their presentation of other physical symptoms as well. Low pain threshold is also another characteristic of somebody who's dentally anxious. We can measure the amount of pain that people are willing to endure by exposing people to the same types of stimulus and then seeing how long they can endure it. A very simple way of doing this is getting people to put their hands into cold water. This is how this is measured experimentally. This isn't obviously a clinical thing to do. In experiments, if you get people to put their hands in cold water, and then you can measure how long they're willing to do that, you can get a rough estimation of pain threshold. Now, obviously, you won't know what somebody's pain threshold is like whenever they come to you in a clinic, but it is useful to know that different individuals have different experiences of pain and different levels of pain that they are able to tolerate. It's very important for dentists to realize that and not to minimize the level of pain that somebody is either experiencing or is able to put up with, to endure. Dentists saying things like, "Oh, now come on, that's not sore," or "You can do better than that." These types of statements aren't really helpful. They are just likely to increase the patient's sense of shame, which increases their anxiety, which in turn may well increase their perception of pain. So therefore, it's important that dentists understand this as an important aspect of working with people of all descriptions when it comes to pain. There are obviously diagnostic simplistic labels of different types of anxiety. Health anxiety, social anxiety, generalized anxiety disorder, to name but three. If somebody has a diagnosed anxiety condition, very similar to the idea of them being high negative emotion, this is also something that makes somebody more likely to have problems when it comes to fear of the dentist. We've mentioned a lot of anxiety, but also depressive disorders as well. Depressive disorders, sometimes called mood disorders, whenever people feel very low, very lacking in motivation, very overwhelmed potentially. These are also conditions that are often comorbid with dental anxiety. When it comes to anxious thinking, there's two main areas of fear. There's the fear of negative health outcomes. That's the fear of pain. That's the fear of maybe the dental work going badly. It's maybe the fear of catastrophic failure and hospital admission, for example. But there's also fear of negative social outcomes. These are the this is the other side that people fear, the other side of the coin of things that people fear. Very often when people come to the dentists, they're afraid of a negative social evaluation by the dentist themselves. They're afraid that the dentist will shame them for the state of their teeth. They're afraid that the dentist will belittle them, that the dentist will make them feel small, make them feel judged, undervalued. Sometimes this can seem small to dentists, but in actual fact, it's very important to a lot of patients. You can imagine yourself what it's like if you have ever been in a situation where you're evaluated negatively and judged by your doctor or by your peers, or maybe by an academic when it comes to handing in essays, etc. That's the same type of fear that somebody who's dentally anxious feels when it comes to the dentist, when it comes to the way that the dentist thinks about them. And therefore, if they have had bad experiences of the dentist, bad experience of treatment, sometimes those can impact upon their feelings of dental care as well and their experiences. Sometimes even benign experiences are recalled negatively. Sometimes things that people have experienced that were neither up nor down, or certainly as the dentist doesn't perceive as being up or down, can be remembered negatively, and that can impact upon somebody's presentation as well. So here's examples of some of the different thoughts that could be going through the patient's head. Not only the patient, but also the dentist as well. The dentist himself can be extremely stressed by the situation. They themselves can be afraid of the situation going wrong, and that can also heighten the levels of dental fear. And so, anxiety can end up in a maintaining cycle of its own self, where some event kind of happened or is happening, a dental experience where maybe the dentist is a bit harsh, maybe the dentist tries to tell the patient about dental care and how they're not looking after their teeth properly, for example. This can result in perceived exaggerated or inappropriate threat. I think that's maybe a little bit pessimistic. It's not even necessarily that the patient is misinterpreting the threat. A dentist could well be saying to a patient, you're not good enough. You are in some ways inadequate because you haven't brushed your teeth appropriately. So the threat might actually be real. It may be that the person is experiencing social judgment, and it may well be that that's what the dentist is offering. Therefore, fight or flight kicks in. The person has mechanisms and ways of dealing with threat to protect themselves from threat. This gives a short-term relief to anxiety, but it doesn't actually challenge the problem in itself. It tells the person that, oh, that short-term problem of either running away or avoiding the dentist or arguing or being very submissive and what's called fawning, fight, flight, freeze is what we normally think of, but there's also fawn or friend, which is where somebody deals with social threat by being overly nice. And an extreme example of this, which is around in popular culture, is Stockholm syndrome, the idea of where somebody falls in love with their captor. Maybe that's the only response that they have. That's the only way that's the only option left to them to deal with this problem. This gives short-term relief, but it doesn't actually challenge the problem. So the fear actually remains intact, and the alarming belief is left unchallenged, and therefore the cycle begins again.